Our NICU at St. Louis Children's Hospital is a level 4 NICU. It's 150 beds. We're located on the Washington University Medical Campus in the heart of St. Louis City. We are just a bridge away from our delivery center so that our fetal care patients and our extreme premature patients are just a short walk to level 4 care. But we also have referrals across the region, and we have a transport team that can fly or drive to bring sick patients from across the region to receive care here at our NICU. One of the most important things to recognize in our neonatal intensive care unit is that no one person delivers the care. The care is delivered as a team.
Our unit is staffed by a large dedicated team of bedside nurses and support services, in addition to a multitude of pediatric subspecialists and pediatric surgeons. This, in addition to cutting-edge research right here on the medical campus and the latest technology, allows us to take care of the smallest patients with the most complex conditions.
We are one of the few centers in the U.S. and the world to offer infant lung transplant. The most common reason for transplant referral are the genetic disorders of surfactant metabolism. However, we do receive referrals for infants with severe lung disease without clear explanation. Infants and their families who are awaiting lung transplant are cared for in our NICU until the time of transplant.
Recently, our NICU has developed a small baby program that improves the care for our smallest premature infants. We have a severe BPD program that is a multidisciplinary program between our pulmonary doctors, neonatology, and cardiology to improve care. We also have a renal replacement therapy program for neonates with congenital renal anomalies or those who have acute and chronic renal failure secondary to their disease in the NICU.
Oftentimes, the care of our smallest patients happens even before they're born. Our Fetal Care Center is a really unique collaboration across the medical campus between Barnes-Jewish Hospital, St. Louis Children's Hospital, and Washington University physicians. We're able to provide care to a mother and her unborn child up through delivery and beyond. If needed, we are able to perform in utero procedures to improve the outcome, including treatment for twin-to-twin transfusion syndrome, in utero surgery for spina bifida, both open and fetoscopic, surgeries in utero for sacrococcygeal teratomas, and exit procedures if needed for lymphatic malformations or airway malformations. Through our membership with the North American Fetal Therapy Network, we are able to provide our patients with cutting-edge research and therapies through collaboration with a multitude of other NAFNet centers across the country, including clinical trials such as the RAF trial for renal failure in neonates.
Our CDH program at St. Louis Children's Hospital starts before birth. Once a family has a diagnosis of CDH, they'll be referred to our Fetal Care Center. Our CDH program has achieved survival of almost 90% over the last 5 years, in large part, I think, due to the care provided at every step of the way for the patient, and a much greater focus on the cardiovascular support of the CDH neonate. Now, even with all that support, around 25% of infants at our center will require ECMO. ECMO at our center is delivered very well because we're a platinum center for excellence for ECMO. So when we get to the point where we need this additional therapy, we have really high fidelity ECMO care. Once we get through the NICU, through this long journey with the family and the baby, they'll follow in our CDH clinic. So we go from before birth through the entire hospital stay, and then the same group of physicians will care for them in the outpatient world.
In addition to patient care and education, research is also paramount. At St. Louis Children's Hospital, there is an environment of inquiry and improvement, and many of our NICU families participate in research studies. Research has the potential to not only help infants in our own NICU, but also beyond. Washington University is one of the clinical sites and model organism screening cores for the Undiagnosed Diseases Network, or UDN. When an infant in our NICU is suspected of having an underlying genetic condition and whole genome sequencing is not diagnostic, we are able to enroll infants and their families in the UDN here at Washington University. Our infants are able to receive cutting-edge genomic technologies, including transcriptomics, long-read RNA and DNA sequencing, as well as in vitro and model organism studies to try to identify the molecular cause of their condition. I'm always so impressed by the resilience of infants and their families. And it's truly a privilege to help infants thrive and support their families along their journey in the NICU.
Our team of doctors, nurses, and staff come to work each day knowing that we can improve lives and outcomes of our tiniest patients.
What keeps us going each day is working with people side by side that care truly about their patients and their families. Our nurses are at the bedside for 12 hours a day, caring for critically ill infants, and all of this work that they do makes a difference.